Okay, so grab that little PowerPoint. It's just really short, kind of a discussion over healthcare in general, and we'll look at kind of structure and organization. So what would you say, is how available is healthcare? How accessible or how available is healthcare for us?
Pretty available.
Pretty available, right? Just go when we need to for the most part. What else? What about specialty care?
It's pretty available.
We can get there, right? I mean, there's places that are a little bit more difficult to get to, but, Dallas is not far from us, and there's so many specialty hospitals there and things like that. In comparison to even for us here in Cooper, which, we don't have a whole lot of access within the town, but it's still, just a quick drive away. When I was in Ethiopia, right after I graduated nursing school, I worked in Ethiopia in a clinic for, I guess, 3.5 months, something like that. And it was rural. And when I say that, I mean, like, I flew into Addis, which was the capital, which was a really large city. Okay, but then it took 2 days to drive to where I was. Now, I know you think, okay, 2 days, that's like driving to like New York or somewhere, but it's not really that far. Okay, the roads are so bad, you just can't go very fast. So it's 2 days of travel, but it might have only been, a few hundred miles. I mean, Ethiopia is not that big. So, anyways, it's just a very remote place, like so remote that on my way back, I was there during the rainy season, and on my way back, it was so muddy that they couldn't drive me back. I had to walk a pretty good section of the way to get back. So the truck where I was working, they took me as far as they could, and the road just got so muddy that they couldn't go on, and the ruts were so deep that wasn't safe to pass through there. And they dropped me off with these men that were carrying my bags, and one of the other nurses walked with me most of the way. And so they dropped me off, and at the other end of this long, muddy pass that was several miles long, I don't know, it was 3 hours of walking. I don't know exactly how far it was, and I was in rubber boots. But this car was just waiting there at the end for me. We coordinated our timing wise, when everybody would need to be where. And so at the end of this muddy pass, there they were, ready, waiting for me. So loaded me up and went on. So that's how remote it was. It was very remote. But even for me, while working there, the clinics, the government clinics at that time, where we were just not very good. So, for example, they might give somebody an antibiotic, and they might only give them 3 days of antibiotics. Well, normally, how many days of antibiotics do you take if you take some? Usually
10,
right? Or 7, or maybe 14. There's some specialty medicines, like if you take a Z-Pack, it's only a few days, but it's a lot stronger medicine. But these clinics were giving people antibiotics. They might give them amoxicillin for 3 days. Well, the only thing and you guys need to know this too, when you don't take a medicine its full course, it actually causes your body to react in such a way that medicine won't work anymore. It's kind of like your body builds up a tolerance for it, sort of, and it just doesn't work. And it can actually make the infection worse, because it can make it so that particular bacteria that's causing infection can now not be affected by that medicine anymore. So it's really important that you take the whole 7 days or the whole 10 days so that it doesn't come back and that bacteria doesn't, get stronger. But at this particular clinic, they might just give people 3 days of antibiotics. Well, that was doing nothing but making everything worse. And the other thing is tuberculosis is probably the thing I saw, the disease I saw the most. Have y'all heard of tuberculosis? I think so. If you've ever watched, there's an old Western movie that I could not think of, Lonesome Dove. Maybe that was it. with Doc Holliday. Y'all never watched it?
I probably have, but
Anyways, consumption. If you watch any old westerns and they talk about somebody having consumption, or they have a cough or they cough up blood, that's usually tuberculosis. It's very, very, very contagious. Like it's spread by air. So it's very contagious, and it's a lung disease, and it develops nodules in your lungs. But it can also travel to other parts of the body. Like we saw lots of people who had like a tuberculosis meningitis, which is infection of the lining of your brain, and it was infected with that same bacteria. I saw some that came in with a spinal tumor that had started because of that bacteria, and literally his spine, he had lost probably 6 or 8 inches in height. And literally his spine, when you looked at him from the side, it went out like this, like it had this big lump in it, because that bacteria just like eaten away, his discs basically, and it was just kind of crushed it on top of itself. And I don't know, a guy had a tumor on his kidney he would drain. It was nasty. So many things I would never even dream of doing here, but there, it was their only hope. And that's the thing, at that clinic, people would walk for 2 days just to come to that clinic to get treatment. We had one husband and his son, who's probably 14 or 15, so it's kind of hard to tell. But they would carry their mom on a stretcher for 2 days to bring her to the clinic in hopes that they could, would get help, because they had tried so many other things. And sometimes we don't realize how accessible it really is, because it's not like that everywhere. I mean, they just go get a shot or go get an antibiotic, and I don't know, it's not that easy everywhere. Okay, so how available for us? We have government healthcare services, right? We have Medicare, we have Medicaid, we have CHIP, we have all kinds of government. The VA is another example of a government-funded organization. Our city or county hospitals are government-funded, so a lot of government funding goes into those. So lots of different options. We have private hospitals, right, that are owned by an organization or a nonprofit or something along those lines. So like Baylor is an example of a private hospital. Presbyterian is another private hospital. And clinic, and even like home health agencies, those are private owned. So, and then industrial, even at the workplace, sometimes we forget, but we have a friend who was working at Kimberly-Clark. He was like a personal trainer, like a health fitness. I guess he did some consulting and things like that. So there's even jobs within big industries too that are healthcare related. Okay, some local healthcare services. Of course, there's always a city or county health department. That's where you find like birth records, death records, things along that line. Now, I think as far as the health department goes, we probably have portions of, I don't know exactly how it works in Delta County. We probably have some of those things are taken care of here, but then other things we might go to Lamar County or Hopkins County for. Like Lamar County Health Department, you can go there and get immunizations, things like that. I don't know what immunizations are.
Shots to prevent diseases.
Right, vaccines. So make sure you see that word. City or county hospitals. So I think Parkland in Dallas is considered like the city or county hospital, so taxes help pay that one. And usually a city or county hospital has to take whoever comes in to get treatment. And they have to take care of them. Now, all hospitals have to take care of people in an emergency situation. It doesn't matter where you go, private hospital or not. If somebody comes into the emergency room, they are required to at least stabilize them, and get them in a safe place. And then senior citizen centers is another example. Like we have Meals on Wheels. State health services includes like our Department of Health. As far as the state goes, they keep up with records. They do like an M-Track immunization tracking, all kinds of info. If you go to the website, there's educational information there, information about disease. I'm sure that Like when the Ebola outbreak was happening last fall, there would have been all kinds of info on that at the health department. So there you go. There. Also, Department of Health is what does like investigations if there's some kind of problem with food or a restaurant. They would be involved in that. State medical centers, there are some state ones, mental hospitals. Terrell used to be a state mental hospital, although I don't think it is considered the state hospital anymore. I don't know the name of it now, it's changed. And then Texas School for the Blind and Texas School for the Deaf. These are two resources for the blind and the deaf. And some of you guys may want to research those whenever you get to your agency presentation. But lots of resources for those populations there. And then federal health services, whenever you see that word federal, that means it's federally funded. So it's like the U.S. government, okay, versus state. So another example, Medicaid is state funded. So when like I get my check every month, they take out money for Medicaid, but that goes to the state. That comes from Texas. And so the state kind of within bounds makes up their own rules around Medicaid. They can determine, the level of income that would qualify for it and so forth. There's boundaries there, but versus federal health services, Medicare, which we're going to talk about both of those next week, is a federally funded. That's the kind of insurance you get after you've worked for a certain period of time and you turn 65, then you can qualify for Medicare. So that's the difference in those two things. Medicare is a free insurance for the elderly. 65 is not old anymore, but so the elderly who have worked, or Medicaid is based on income. But it's also a government insurance. The VA, the Veterans Administration hospitals, any kind of care that's related to that, those are federally funded. So that means it's funded by the U.S. government. Well, all of us in general, but the U.S. government. And that's for people who served in the armed forces. And there's different stipulations and what different people qualify for, and there's a few different insurances within that. But then the CDC is the other federally funded service, and there's other ones that go along with this. These are the CDC response and like epidemics. CDC were the ones that really had like all the protocols for the Ebola outbreak, and they would come in. And we watched Contagion. Y'all ever watched Contagion? We'll probably watch that this year.
I think we watched it last year.
In Bali.
Pretty
Yes,
sure.
we did. There's another movie, since y'all have seen that. I might see if I can get my hands on it. I don't know. It's called Outbreak. It's rated R, but it's like an old rated R movie, so it probably would just be rated. Radar is what they used to. Anyway, so that's that. You watched like World War Z. I think the CDC was involved in that one. If you watch that, I kind of like that movie. And then we're going to talk about healthcare facilities in a minute. I'm going to let you guys kind of look over those, and we're going to talk about those. So that's that. As far as this goes, just kind of some notes I wanted to go over, just kind of basics. And it goes, let me make sure I have something else. We're good there. Let's look real quick at this agency presentation. And I'm going to kind of go over what I expect of you guys for this presentation. One, change out this date for you guys here. That it says due Tuesday, 9/4, but that's actually Friday. I don't know what happened to my brain. Well, I know what happened. I used this paper last year and I was changing it up, but I changed the date, but I didn't change the day. So this will be due on the 4th, which is next Friday. No. Yes, next Friday, a week from tomorrow. Okay, so it says choose a local, state, federal, or World Health Service organization to research. So you can pick from this list, or if you've got something different that you want to use, that's fine too. And we'll pick those in just a second. So look, it says you may use a textbook as a resource, or you can use any online resources. And you guys are going to have tomorrow and Monday and actually Wednesday, I think, to work in the library on this. Now, this one is not a test grade, and I'm not going to grade your presentation over it, just to kind of get into the mode of doing presentations and doing projects. This is kind of like getting your feet wet. So we'll do lots of things like this over the course of the year. So this one is just a daily grade, and I'm just going to grade your paper part, your info part, not your presentation, but you're still going to present. Now, my big things about using resources, one, make sure for this assignment, at least write down your website. So make sure as you're looking things up, you write down your website so that you've got that information. Okay, do not copy and paste. That makes me angry, and I will just give it back to you. Okay, I hate copying and pasting. Not to mention the fact that it's plagiarizing. You do that in college, you get booted out. Okay, so then that would not be worth it. No Wikipedia, no blogs. Anybody and their mama can write what they want to on the internet. So I want information that is reliable. My suggestion is go to, if you're going to do the Department of Health and Human Services, go to the Department of Health and Human Services website and get your information there. And that's going to be reliable. And that goes for any of them. March of Dimes, they're going to have their own. You know what March of Dimes is? It's like the premature babies awareness, and they do foundation for that. So they do a lot of fundraisers and things like that. And I put lots of different things on here, so everybody will have something different. But yeah, no Wikipedia. I'm okay with you going to Wikipedia and finding out information too you can use to research. So for example, if you don't even know what MHMR is, and you type in MHMR and Wikipedia comes up, you can click on Wikipedia and look up and see that it's what it's used for, and then research from there. That's okay, but I don't want you to pull out your meaty information from Wikipedia to write out your report. Make sure you write them down too. I didn't put that in there, but that's always expected. So give credit where credit is due. If you use more than 3 words directly from a source, that's plagiarism. Okay, that's not writing your own. So if you go, whenever you're looking these up, my suggestion is find the About page or Info page and look up. They're going to tell you what the mission of their agency is. Now, you're welcome to use quotes, if you want to use a few quotes, but don't let that be your whole explanation. But summarize whatever they say and put it in your own words and write out a summary. That's what I want you guys to do. Okay. Answer the following questions in outline or essay form. You guys will see over the course of the year. I love outlines. To me, they just make sense. They're organized, and I like it. But I'm good either way. It's not going to get any more or less points, outline or essay form for this. And that says attach it to your homework Dropbox. Just ignore that. That was from an online student. So I need to actually get rid of that whole statement. Okay, so here's the questions you have to answer. 1, what is the purpose of the department or agency? Okay, what's their purpose? This should be 2 to 3 sentences long. Okay, this shouldn't be, there are no one-word answers on this kind of question. I want a complete answer that tells me that you understand what that agency's job is. Okay, maybe they have different, you might say something about their mission. Maybe they have 10 different things that they're in charge of. You could say, the Department of Aging and Disability is blah, 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 blah. And their tasks, include, and list them out, whatever. Okay, contact info for your department. A phone number is fine, or an email address. That can be a one-word answer. Okay, that's not going to be any big deal. And then what kind of funding? This can be a one-word answer. It may not necessarily need to be. but is it funded by the state? Is it funded by the federal government? Is it donation only? You know, give me as much information as you can, but that one may be a little bit shorter as well. D, it says what people are serviced by the department or agency. What I mean by that is what population is serviced. So is it strictly for kids, or like Scottish Rite is for kids with orthopedic disorders or scoliosis, or, you know, and give me some more information. Maybe there's certain requirements, you know, that go into that, or how are they serviced? You know, what are some different things that they do? And that one should be, you know, 2 to 3 sentences, or at least that much info. And then E, it says, what impact do you think the department or agency has on healthcare? So this is your opinion. After you've learned about this department or this agency or organization, what impact do you think they have on healthcare? What makes them important? What makes them useful? You know, how do they affect people? So those are some things to answer. So A, D, and E should be, you know, a little bit lengthier answers there. I don't just want one word answers. You're not going to get your full 20 points down here. Okay. So then the grading as follows. It says the content is really what I'm grading on this, and it's just each one's worth 20 points. Okay, but I do want it typed. You're going to have 3 days in the library. There's no reason for it not to be typed, so it needs to be typed. And I think that's it for that. Any questions? I'm going to let you guys pick your agency in just a second. I like for things, and just for all year long, but I like for things to look neat and professional and organized. And so that's my expectation. I want to know what question you're answering. You know, if you're going to write an essay form, that's fine, but put you know, what is the purpose of this agency? Go underneath it and write your little paragraph, or write out your information outline. However you want to do that is fine. But I want complete information. I want to know that you know. I want to be able to tell that you've researched it and you know about it. Like, you should be the expert on it after this. Okay? Sound good? And then next Friday, you guys will tell each other about them. Okay, so again, as far as, remember, you go to the website, go to the About page or Info page, contact info, that's how you'll find that. There's usually a contact. There's not a contact information. Sometimes if you scroll all the way down to the bottom of the page, there is info at the bottom, like a phone number or something like that. So that's a good place to look. The other good place to find some of this information is if your agency has like an FAQ section, frequently asked questions, or a Q&A section, you'll see something like that. That might be a good place to find funding and something along those lines. Okay, so those are really good places to start, just to give you an idea of where to look. Sometimes when you get in, especially like the Department of Aging and Disability or the Department of Health and Human Services, they're going to have lots of things that they cover. So you may have to list out some things, but you may have to search a little bit, you know, to find the little bit of information that you need. Okay.